Hey, everybody, welcome to tonight's live. I'm Dr. Tammy, and I have creepy stuff to share with you tonight. It's been a while since I've just really been over the top sharing creepy stuff, but that's what I'm here to do tonight. And I can't believe, oh, Connie said, when was your birthday? It was yesterday, no, Monday. All my days are running together. What is this Tuesday or Wednesday? I don't even know. Yeah, I guess it was Monday. So thank you. It was fun. I took the night off from my lives. And for you guys who are new here, I'm here every Monday, Wednesday, and Friday night, unless it's Valentine's or my birthday. So invite your friends. I would love to have them. Just a little housekeeping. If you guys tap the screen, these little hearts go up. And it makes me feel so loved. But it also tells them that we're having a good time in here and they'll invite more people in. And you all know that my goal in this life, I'm 56 as of Monday, is before I leave this planet, that at least 50% of women, Daphne, yay, 50% of women menopausal age have information and at least have the informed choice to be on natural hormones, because it's a totally different thing than synthetic hormones. And so tonight we are going to share a lot of information. I do have, if you tap on my picture and you go to my bio, there's a little link there. It's called a link tree. And there's lots of free information. So one of the main ones that you're going to want to go download, if you haven't, or if you're new here, is why my doctor said I can't take hormones. And so anything that I say tonight, I think will really resonate when you go there. But the things I'm going to talk about break my heart, and I don't like talking about them, but I think it's really important. Hi, Heidi. Hi, Elaine. Connie's here. I love it. You guys are here. My tribe. I love you guys so much. Thank you for being here. I know there's a bunch of places you could be, so this means a lot tonight to me. So I love it. I love it. Okay. So I'm going to, I forgot what I was going to do, which board I was going to do. Okay, I want to start here. And so the name of the talk tonight was how to prevent breast cancer. And so a couple of things that we have to define, and I totally get this is such a scary topic for a lot of people. But one of the first things that we have to define is what causes it, and then what we can do about it. Because if you don't know what causes it, you can't do anything about it, right? And so everybody thinks they know what causes breast cancer, but then they kind of sit back and they go, well, no, we really don't know what causes breast cancer. And then we have all these organizations that are trying to create breast cancer awareness, right? But who cares about breast cancer awareness? We want action. And it's not about the cancer industry. It's not about more chemo. It's not about more research. It's about prevention. Because if you can keep from getting it, then you don't have to worry about treating it. And the problem is that some of the cures are worse than the treatments. And we're going to talk tonight about some of the treatments that they use for breast cancer actually cause cancer. So it's madness. I know, Elaine. Yeah, exactly. So if you're new here, then you probably don't know how like tinfoil hat wearing I can sound sometimes. And I've actually got 2 videos this week that I got my hand slapped for. So yeah, they had never even made it. Like when they went to review, they got kicked out. So it's so disheartening. So I'm not going to hold back tonight. If I get my hand slapped, what they do to me is they will put me on pause, and one time it was 10 minutes. So if I get my hand slapped, healthy on videos, you disappear. So if I get my hand slapped, usually it's 10 minutes. Now I don't know because it's happened a couple of times. So it could be like they kick me off the platform. So I just want you to know that if it goes dark, hang on, I'll be back hopefully in 10 minutes or less. I don't know what the penalties are. And it's really, Dun's cap in the corner, huh? And it's really crazy because I don't even know what the triggers are. Like one of the videos I did last night was, there was nothing. I went and looked at the rules and the standards, and they call them like community. I want to say those words together, standards. And like there was nothing that I violated. So I know tonight some of the stuff I'm going to say is probably not going to fly. I know there are a few buzzwords that I'm going to avoid, but sometimes they just slip out of my mouth. So I have other videos in my, oh, and I want to tell you too, that if I ever get kicked off here, I am on Facebook, and actually Facebook used to be the really strict ones. And it seems like they've gotten really lax now because there's like lots of things I can like say now, but on here, I mean, they're searching constantly. So, but yeah, so I'm on Facebook, Instagram, LinkedIn, Twitter, or X, whatever they call it now. And, Instagram. So I'm all over the place. I'm actually streaming right now on most all of those platforms. And I so apologize. I see lots of people on Instagram. I focus everything on my TikTok crowd. Then that's where I'm interacting the most and I can see the comments. And so I can't really look at all of the places that I'm streaming right now. So if you guys, I'm looking over here, if you guys find me on TikTok, it's Hormone Bliss, Dr. Tammy Tucker. You can ask me questions there because I'm all about answering questions for you guys. I always have topics, but you guys are the important part and the interaction is so important to me. So anyway, so if I disappear, and please make sure that you do go to my bio page and click on the link and just download any one of those. Oh, there's Doreen. Hi, Doreen. There's Dana. My birthday was awesome. Thank you. And if you go click on any one of those and get any of those free downloads, lots of information, education, then we'll capture your email because if I don't have your email, I don't really know how to tell you where I'm at. So, okay, that's enough. I've just rambled on, a little intro, got the housekeeping out of the way. So, okay, so I'm going to talk about tonight. I hope absolutely freaks you out and has you talking because the more we talk and the more awareness we have about all this stuff, the more impact we can make. And what I want you to take away from tonight is to feel very, very empowered. And although there are so many things in our environment that we can't do anything about, there are lots of things that we can do to combat it, like taking supplements and exercise and changing our lifestyle. So, but I'm going to give you very concrete, real things that you can do because it's like great to say, oh, just go exercise and, eat better and stuff like that. I'm going to give you some really concrete things. And I always like for you guys to stay to the end so I can like keep you hooked to tell you something that you don't know. So, or you might not know. I mean, you guys know a lot. But I always like to kind of keep you guys hooked till the end, but I can't really think of anything tonight. So please stay till the end. And then maybe by the time I talk, I'll come up with something really cool at the end for our goal to stay. So again, we have to get to, and we're going to talk about, and I'm going to focus on breast cancer specifically. There's lots of different cancers, but I'm going to kind of focus on that because that seems to be when the hormone girl, hormone queen talks about hormones, that's what comes up all the time. So I think we really have to address that elephant in the room. Okay, so what causes cancer? And the number one thing in my mind that comes up is lack of hormones. So perimenopause, hormone dysregulation, because we all have learned to associate hormones with breast cancer. There's no doubt about that, right? But the question is, what about hormones increases your risk of breast cancer? Is it certain kind of hormone? Is it ovarian hormones? Is it thyroid hormones? Because thyroid's a hormone. Is it insulin? Insulin's a thyroid. Insulin's a hormone. There are lots of different hormones. So we have learned to associate hormones with breast cancer, right? That's fine. Everybody seems to do that. Nobody in the world would probably disagree that hormones have something to do with breast cancer. Why? Breast tissue is very hormone responsive because it has to be, because that's what we do. Women are physiologically designed really to just have babies. I mean, it's like, in the 20th century, we're so much more than that. We're like, bring home the bacon, fry it up in a pan, and be all the things. But physiologically, we are just designed to have babies and to procreate. And everything in between is just fluff. So when we're little, we're actually baby girls who are developing breast tissue. And then as we go into puberty, now we are moving into reproductive urges. And then we move into our fertility years. And then literally after the age of 50, we just freaking dry up and we're done. And we start the dying process. But all of the hormones from our ovaries that drive these processes are what dictate our breast growth, our breast development, our breast ability to feed a baby, and basically to be moms. That's really what we're designed to do. Now, not all of us are moms, and some of us have jacked up hormones and can't get pregnant, and it's not our choice. We have fertility issues. And my beautiful fiance, my moderator, is always saying, would you please get your fertility program out, because it is amazing. It's all natural. And I've had crazy good success rates with that. So I promise that's coming. It's just had so many projects working on. But all of it is when we come back to, there he goes. He's already putting it up. I love it. Okay. So everything that we do is hormonally influenced. And so when we're 9-year-old girls trying to grow breasts, we need a lot of estrogen. When we are in our fertile years, we have a lot of estrogen circulating. And then when we're in our postmenopausal years, we have no estrogen. I mean, you check estrogen levels on me. I'm 56 as of Monday. You check me without my hormones for a few days, it'll be that little less than sign. Remember that little less than sign from like algebra when we were kids? That's like less than. It'll be less than 5. That's the assay where it picks up. And if you think about who gets breast cancer, is it a 9-year-old girl who has estrogen levels through the roof because she's hormonally actively growing breast tissue? Or is it a 56-year-old female who doesn't have any hormones? It's us. I mean, occasionally, like rarely a 14-year-old girl would get breast cancer. I mean, it is so rare. And that's when their estrogen levels are the absolute highest. So I want to kind of make you ask questions, because that's where our power is. When we ask questions, when we're curious, we move into this zone where we are then empowered. And that's the zone that I want you to be in. And so when we just kind of stop and say, wait a minute, okay, so a 9 to 14-year-old girl has the highest estrogen levels that any woman is ever going to have. And then you take a 50-year-old woman who has none, and who's getting the breast cancer? It's those women, right? Low progesterone, estrogen dominance, we see it all the time. Those fluctuations absolutely causes problems. And then when we look at that and we want to say that, okay, hormones cause cancer. And if you're a 9-year-old girl and they're putting you on birth control for your estrogen dominance or progesterone deficiency, or for birth control, like hopefully you're like 16 before they do that. But they're never saying that's going to cause cancer. No doctor ever has a problem writing for that. In fact, I think I was 14 and my parents freaked out because this was back in the 70s when like it wasn't even talked about, but I was having such bad problems with what I know was endometriosis and PCOS back then, that my mom took me to a doctor and he wanted to give me birth control. And she was like, oh my gosh, no, because if her father finds out about this, this would be like World War III. And it was never discussed again. So I lived with hormone problems my whole life pretty much until I learned what I'm helping you guys with. But not once did that doctor have any problems, right? Would write for that prescription. And doctors everywhere today will write for birth control and never say that that's a problem. But I'm going to show you that it is a problem here in just a second. Sunflower says, I refuse the BC. That's a good thing. Now, it has its place. Don't get me wrong. And I've written plenty of birth control. I don't do birth control pills for reasons that might be a little bit beyond the scope of tonight, but I don't like any sort of oral synthetic hormones that go through the digestive tract, only topical. And even just this week, I did write for a birth control patch. So yes, and if you're scared of synthetic hormones, you have every right to be, because it's a totally different ball game. But do I do it? It has its place, and only for short term. If a woman is bleeding her, guts out, and we have to stop that bleeding, and I don't want her to have a hysterectomy, my bioidentical natural hormones are probably not going to cut it at that point, especially if her iron level is 2. So, well, not that low really, but but you kind of get the point. So sometimes we do have to do that, but it is not a go-to. It is not something that I just say, oh, let's just do this and write these synthetic hormones. So when we talk about what has happened and what actually causes breast cancer, and I'm going to go through the history of cancer here, breast cancer, in just a minute and show you the timeline so you can get a perspective on what's been going on. But the lack of hormones, if you look at, and I love this graph, I do this all the time. If you put hormones on a graph, and let's say you go from birth to 100 years old, and at 50 is where most women go through menopause unless you've had a hysterectomy or your ovaries removed or something. But these are your hormones. This is estrogen, progesterone, testosterone. This is about puberty. So it starts rising and it fluctuates. And then we have the perimenopause. I've seen a lot of perimenopausal women just recently in my office. I mean, it's like a epidemic of, I guess it kind of cycles through, but a lot of perimenopausal women, when your hormones are fluctuating wildly and estrogen dominant. But if you look at this, after your ovaries, you run out of eggs, we literally stop making ovarian hormones. And so we have this whole time from 50 to 100 when we literally live without estrogen and progesterone. Are you saying mammograms cause cancer? I'm saying it's something to consider. Oh, you already jumped ahead and saw my thing. I'm not saying anything causes cancer. I'm not giving medical advice here. I'm just opening the thought of curiosity. Okay, so just kind of ask questions and go, so I'm not giving medical advice. I'm not telling you to do something or not to do something. Get mammograms, don't get mammograms. I'm just going to show you some data so that you can make your own decision, which doesn't happen very often in the medical field. And I am a medical doctor. I'm just a very curious medical doctor who does not just take the whatever I'm told, right? So I just want you to ask questions and really get intuitive and kind of get inside and just discernment. I love that word discernment. I know it's like a totally kind of biblical phrase, but discern what feels true to you or not. Now, some people just kind of buy into this narrative and they dig their heels in and that's their truth. And they won't be curious and they won't ask questions. And I see that with doctors all the time. And that's why I call it indoctrination. And I am a medical doctor, and I was always getting in trouble in school because I was always asking questions. I'm like, well, why is that true? And I actually had one of my attendings tell me one time I was so overwhelmed because there was so much to learn and I wanted to help my patients. And I'll never forget, I was so overwhelmed and just in tears. And I'm like, I'm never going to be able to get all of this. And he said, in this sweet little grandfatherly tone, Tammy, stop crying. I was like, okay. And he said, you'll just memorize 10 or 15 medications. You'll use them very frequently. And don't worry about it. You'll make a good living and you'll be fine. And I was crying for a new reason in that moment because I was like, okay, you're telling me, like, part of me was like relieved for a minute because I was like, really? It's that easy? And then the other part of me was like, you're really serious, aren't you? And that's what we're dealing with. We're also dealing with this whole change in the early 1900s when the Rockefellers, who had the big oil money, figured out that they could take, figured out that they could take their products and make drugs out of them. And then if there were any doctors who want to do natural treatments, they would demonize them and steer them away into using big pharma and would actually defund those medical schools. And so the medical schools needed that money. And, therein lies this history of big pharma and doctors who were outliers, who were talking about supplements and talking about natural health, were then demonized and we're the crazy ones, right? So, and I do walk that thin line because I still do medications and stuff. I'm still a doctor. Advice on balance of LH and FSH. I have MT5 TH3 metabolite of cortisol, 5 THF, 3 metabolite of cortisol. So that's complicated with LH and FSH. Balancing that out, you have to get your estrogen balanced with your ovaries. When you say 5 THF, metabolite of cortisol. That gets a little complicated. So I know the Dutch test breaks all that down, and I try not to get that complicated, but Sunflower, if you want to direct message me, I can give you some more answers. There's also the methylation issues that come in with those metabolites too, but I could do a whole talk about that sometime, get really nerdy. I'm a family doctor, family medicine, boarded in family medicine, and I'm not a gynecologist. And one of the sad things that I find, Nancy, about gynecologists is these are women doctors, and they don't even really know much, if anything, about menopause. All they know is synthetic, big pharma. It's just so sad to me. And they're so busy doing pap smears and surgeries and delivering babies if they're OB that I have so many patients tell me, I tried to my OBGYN and I didn't get anywhere. I got birth control. I got offered birth control or antidepressant or something or off. So that's one of the frustrations. The only reason I ever got outside the box was because I had to, because I had all these hormone problems. So it can be very frustrating out there. And I honor that if you women have had that. Bioidenticals, yes. So I have a lot of videos if you go back and watch my feed on the difference between synthetic and bioidenticals. So I'm going to jump in just a little bit. Oh, and my moderator fiance wants me to tell you that we have test kits. So if you want to get your estrogen, progesterone, testosterone levels checked, which is very important to prevent cancer, breast cancer specifically, if you want to get your levels checked, you can go to Hormone Bliss, that's our website, or you can go to my bio page, and there's a link there with a little yellow finger pointing down to the link, and you can go and order a test kit. And it's a saliva test kit. You don't have to go to the lab. This is the same lab, though, that we do blood, serum, urine tests, all the things in this lab. So, but the saliva is really easy, and it measures your tissue levels. And especially we use the bioidentical hormone creams. And so the tissue levels are really one of the best ways to see if the creams are working. So we love these. So you order your test kit, you spit in a little tube, and you send it into the lab, and it's free shipping to you, and it's free shipping to the lab. You fill out this form if you're on any hormone therapy right now, or if you have any of these 30 plus symptoms on here, which can be frozen shoulder. I would like to say that one. Weight gain, fatigue, not sleeping, vaginal dryness, losing hair, chemical sensitivities, brain fog, memory problems, hot flashes, foggy thinking, allergies, sugar cravings. Anyway, the list goes on and on and on. You fill that out, you pop it in this mailer, send it through UPS in this bag, ship it in. We get your results. Just found on my For You page, what state are you in? I'm in Arkansas, Lori. And so you just mail it in, we get your results, and then we make recommendations. Irritability, yeah, all the above. And then we make recommendations for bioidentical hormones. All natural, completely different. They are prescription strength. So it's like what you would get from someone who does compounded hormones, but you don't have to see a doctor for this. So we make all the recommendations and get you on bioidenticals. And Connie said, super easy and worth knowing your hormone levels. Yay, thanks for the plug, Connie. Connie's one of our tribe members, so it's awesome. Okay, so that's how that works. And we have a code. It's normally $129, but we have a code TikTok 20. We just had our St. Patrick's Day special, and that's over. So yeah, my moderator saying we sold a bunch of kits, yay! But if you use TikTok 20 at checkout, you'll save $20 off. So I think it's just a little over $100 to get your hormone levels checked. And if you could find a doctor who would actually check your hormone levels, it would probably be like $600, $1,000, because your insurance would probably say it's not medically necessary, which is absolutely stupid, because if you didn't have a thyroid, they wouldn't say getting your thyroid tested wasn't medically necessary. So I don't know. It's just, it's dumb. Okay. So anyway, so what causes cancer? So a lack of hormones. When you have this issue here, when you are younger and you have your hormone levels that are high and normal or not normal, your risk of breast cancer is really low here. But out here, when you have no hormones at all after your ovaries literally dry up, and I always say that if you check ovarian ultrasound on a woman 10 years out from menopause, the radiologist, and I've seen this many, many, many times, will actually read the ultrasound as ovaries not detected, because they just dry up. They have no hormonal influence anymore. They don't exist. So they don't even see them. They can't recognize them. So When your ovaries dry up, you don't make ovarian hormones. And this is where your biggest breast cancer risk lives, and you don't have that preventive benefit. And it's about the balance too. MP said it's not necessary to do labs because you go by symptoms, and she's right. That's her opinion. That's your opinion. I don't believe in that, because how could you, if you had your thyroid removed, how could you dose your thyroid on symptoms? Well, my hands and feet are cold. Okay. And then there's so many doses, and there's so many doses of female hormones. There's so many doses of thyroid. I mean, you wouldn't just, like, somebody's having a lot of thyroid symptoms and put them on 300 milligrams of Synthroid. You would want to know what the levels are. And it's true, after menopause, you have no ovarian hormones. But then when you start replacing them, don't you want to know what your levels are, if you're getting too much or not enough? So to me, it makes sense. And there are lots of people who have different opinions. I've been doing this almost 25 years. That's the way I do it. And I have really good results with my patients. And so, the baseline being 0 is one thing. And then once we start them on hormones, and we can check, and I do go by symptoms. I never treat numbers. I would never treat a person as a number. And that's very, very common. But I do like to see what's going on. And if they start having, I call it side effects when we're treating and getting the hormones balanced. Before, it's symptoms of menopause or perimenopause. Now it's side effects, because now we're inducing, even though they're natural hormones, we're bringing something new into the system. So now I call it side effects, right? But it's still just symptoms that are shifting around. Okay, thank you, Madeline. I appreciate that. So yeah, Carmen, thank you. So again, everybody has their way of doing it, and it works fine for some people. One of the things with me too is that I know that these levels are so beneficial here, and I want to try to restore those levels, because we're not just trying to treat symptoms. We're wanting to use the largest. Now, this goes against everything you've probably heard. The highest amount of ovarian hormones to not get, quote, side effects. We want to get them balanced to protect your bones, to protect your heart, to protect your brain, because you're losing all of that now. And so I want to make sure that I have enough to protect me for prevention of cancer, not just the least amount for my symptoms, because skin aging is just the canary in the coal mine. What's happening in my bones, what's happening in my brain, what's happening in my blood vessels, my heart, why is my blood pressure going up? So Darcy says, so once we order the kit, how much is the follow-up kit? So once you get the kit, the follow-up to get your results and get a plan for your bioidentical natural creams is included in that. And then once we get you in a program, it just depends on what all you want in your program. And, there's different pricing depending on if you want to do a year at a time or just month to month. So it kind of depends. I'm not trying to be evasive, I promise. But it just, once you talk to somebody, they'll give you the best plan for you. And we want it affordable for everybody. That's really important, because if I'm going to reach my goal of having 50% of women back on hormones, it's going to have to be massively available to everybody. So that is my passion for sure. The follow-up kits are a part of the program. So whenever we put a program together for you, then we can discuss what happens with kits. But it's only $100, a little over $100 to just get a kit. So it's the follow-ups, depending on what you do. But the most you pay is, and we give discounts on kits, and we do cortisol testing and thyroid testing and all that too. So it just kind of depends on what we need to test. So I hate that it depends, but we want to make it fit you. So, okay. So what causes cancer? So we said lack of hormones, menopause. We talked about that. Hormone chaos. Somebody mentioned estrogen dominance and low progesterone. So estrogen dominance, synthetic, and xenoestrogens. So xenoestrogens are chemicals in our environment that chemically kind of look like estrogen, but they're not. And there are a lot of those chemicals that do that, which also cause inflammation and DNA damage. So a lot of this has a lot of crossover. And the connections are, well, this causes this and this causes this too. So we have to look at all these different things. Inflammation comes from so many different places, and it's causing DNA damage. I remember my first day in biology in college. Just imagine, it's like I'm all, bright-eyed and bush-tailed, and I'm ready. And I'm like, I walk into my biology class and I'm like, this is going to be so cool. I'm going to learn so much. And the very first thing that my professor says, we're in this big, big classroom, like probably 100 people in there. And he says, look around, look to your right, look to your left. And he says, every single person in this room has cancer. It's like, what? What are you talking about? And you got to remember, when I grew up in the 70s, I was born in 69, there was one lady in our town who had cancer, and everybody was like, what is that? I mean, it was so rare back then. It was crazy. I mean, it happened, but it was like super rare. So for this guy, and I'm just in college, I'm like 18, 19 years old or whatever, 20. For this guy to say everyone in this room has cancer, I was like, this guy is crazy. What is going on? But it turns out he's right, because what he was saying is we all have aberrant cells in our body that are potentially going renegade at any given moment. And it is our immune system that keeps it in check. It is our immune system that makes sure that that DNA stays exactly where it's supposed to be, that all that transcription happens appropriately, that the inflammation is kept in check. And if not, we are constantly fighting the risk of cancer. We're fighting cancer cells because cancer is us. Cancer is not this monster creeping around ready to grab you. It's you. It is your cells that are going crazy. It is your cells that have gone rogue and they're not doing what they're supposed to do. And they're multiplying at a rate that they are not supposed to be multiplying. So it is you, and it is how your body is responding, and what you eat and what you put in and what you breathe and how you interact and your stress levels, all of that matters. But it's easy for doctors to say, like, when you need to lose weight, just eat less and exercise more. It's like, no, that's not enough. That's not enough to tell somebody. You have to tell them what's causing their problem, what's causing that weight gain, and then what to do about it. And eating less and exercising more when you're menopausal or perimenopausal is not the answer. I mean, it's like there's more to it. So there's more to this story. Okay. So our focus here has to be on protecting you and getting your body healthy. It's fascinating to me when you think about DNA repair. The number one place that your DNA works extremely hard is your skin, because your skin is constantly exposed to the environment. And the DNA repair that happens there is, the stats show, not they say, stats show that even one sunburn in your lifetime increases your risk of skin cancer by 200%. So, I mean, it's like our DNA is constantly repairing our skin, and then our immune system from the inside is constantly having to do the repair work. Okay, so we have inflammation, sugar. Cancer is fed by sugar. And my brother got prostate cancer probably, oh gosh, what's it been now? 5 years ago. And he was drinking Mountain Dews every day. He was actually working for me at the time. Oh my gosh, his diet was so bad. It's like the worst diet I've ever seen anybody eat. Constantly, he was like Snickers bars and Little Debbie's brownies and sodas. And I was just like, you just had your prostate and most of your pelvis dissected and removed, nerves and everything. And you were sitting there just feeding those cancer cells. And nobody would listen to you when you're saying things like you need to change your diet. But I've had so many experiences in my life when I have seen cancer, like, you can't say cured, but right, I have seen so many huge impacts of changes. My own personal self, like my brother grew up in the same household with me, and my mom did that to us, right? And my mom actually got cancer. My whole family had cancer. We ate honey buns for breakfast, Coke. I mean, I was wired on caffeine at like 6 years old, probably. Captain Crunch, Fruit Loops. Oh my gosh, it was terrible. And then I got in college and I was so sick. I had adrenal problems. I had thyroid problems. I was PCOS, endometriosis, all the things. I was just a mess. And my son's dad at the time said, Tammy, why don't you just clean up your diet? So I stopped eating Twinkies and Cokes and honey buns. And I just started eating some salads and started taking a multivitamin, turned my life around. I mean, I've been a believer ever since because I couldn't even, hands hurt so much. I was so inflamed and so in pain. And just those two changes were remarkable. So if you're listening to this tonight, just know that it doesn't have to be huge changes. I mean, just a few little things can make an impact. Is that why we crave sugar so bad when we've had cancer? We crave sugar because there's so much sugar in our environment, and we crave sugar because we have this insulin resistance trigger, and some people genetically have more of it than others. But I truly believe we crave sugar because we are chasing our insulin response. So if you start breakfast, I'm not saying you are, but if you start breakfast with a honey bun and a Coke, by the time your insulin responds to that, it lowers your blood sugar. Now your body is like, what the heck? My blood sugar is so low. And then the chemistry of the hormones in your body now make you start wanting more sugar. And then your sugar spikes, and then the insulin spikes, and then your sugar drops, and now you crashed, and now you're tired, and now you're like craving more sugar. And estrogen actually balances out in insulin and thyroid. And so menopausal women have a really hard time with sugar. And Ingrid, you're right, sugar is so addicting. There are studies that show that it lights up more dopamine in the centers of the brain that handle addiction than cocaine. So it is very addictive. And the problem is, if you're addicted to cocaine, you can stop cocaine. You can't stop sugar. Sugar's in everything, right? So it really becomes a challenge to balance your insulin. And the only way to do it, to get the sugar cravings down, is to stop eating sugar. And that seems so counterintuitive, but it's like if you're chasing your insulin crashes all day long, the only way you can do it is to get ahead of it. And the biggest way to do it is just eat protein. So if you crave sugar all the time and you just have tons of protein available, your nuts, your cashews, peanuts, whatever, it is that boiled eggs, avocados, if you have that stuff and you just fill up on that, that is what will take your sugar cravings down because that will balance out your blood sugar. So hopefully that was helpful. So we got to get the sugar down. DNA damage, that happens from the chemicals in our environment. It can happen from emotional stress. I know that with my brother, he was going through some really difficult social experiences. And there's so much about the spirituality of where cancers go. And there's a lady named Louise Hay, and she talks about certain pain in the body and how those are emotionally bound up. And so when you think about reproductive organs like breast or ovaries or uterus, I mean, that there's so much tied into our spirituality and who we are and our femininity. And like guys getting prostate cancer, I mean, that he was in a weird relationship, very bad one. Hopefully none of those people are listening to this tonight. Oh gosh, what did I just do? But I really truly believe that a lot of that has an emotional impact. Okay. I just caught my hands. So I'm gonna have to be, I don't even know what I can say now. Eat meat because I don't know what's not processed. I know, right? I mean, there's so much to that. Okay, I'm kind of paralyzed right now because it just gave me this big message that said, you can't talk about that stuff. So anyway, okay. I wasn't even talking about anything that big. I was talking about spirituality. I don't know. Okay. So let's go to immune dysfunction. We talked about that. If that's your immune system having a problem. Okay. And so somebody asked me about mammograms earlier. So we'll talk about that just a little bit. So you can make your own decision. Again, I'm not telling you to have mammograms or not to have mammograms, but did you know that when you compress a breast with a mammogram, that is 42 pounds. Do you know how heavy 42 pounds is? If you took like my weights out there, I do 10 to 15 pound dumbbells when I exercise. So imagine four of those dumbbells laying on your breast. That's how much it's compressed. And we know that you can have micro tears and damage. And we know that if someone has breast trauma, that they have an increased risk of getting breast cancer. I know 42 pounds is a lot. That we know that trauma can cause those cells to change. Because remember, we said cancer is not this monster that's from the outside. Cancer is you. Cancer is your cells that are damaged, that are renegade or rogue. They're doing their own thing and they're not supposed to be doing that. And every process in your body is driven by hormones. So if hormones are supposed to tell your body to do something or not to do something, that's a problem. Katie says, I did not know bioidentical was offered in creams. I thought it was only pellets. Oh, yeah. So I have some other videos, Katie, if you go watch them, because it's kind of beyond the scope here to talk about bioidentical. But bioidentical just means it's the same organic structure as your body. And so you can have bioidentical in creams, pellets, gels, even oral forms, troches that you put under the tongue. So the difference in synthetic is that the chemical nature of those are synthetic. They're not the same as our body. So yeah, so you can do that. And there's commercial pharmacies that can carry those as bioidenticals and synthetic. So yeah. And then those little micro tears can actually spread tumors. And there was a study in 2013 that showed that 1.3 million misdiagnoses of breast cancer over 30 years when they went back and retrospectively studied. So, I mean, and that's terrifying to be a woman who gets a mammogram and she's like told she's got cancer and then find out she didn't. So, I mean, that can be an issue too. And then in 2014, the British Medical Journal, BMJ, found that there's no statistical significant decrease in mortality, meaning death, with mammograms. And it's an $8 billion a year industry. And the American Cancer Society actually lobbies alongside the American Radiological Society. So we have these people who have a lot to gain from you getting your breast radiated every year. So again, I'm not telling you not to, but there are other options. There's ultrasound, but your insurance won't pay for it until you have a mammogram, which is totally ridiculous. And then some people say, well, it's no more radiation than a flight on an airplane. Yeah, a flight on an airplane, you have all this radiation in the atmosphere, but it's not being focused in a 42-pound compression where the tissue is being damaged. Now you've got damaged tissue and you're shooting an X-ray beam right in there, and you're doing that every year. I just don't know. I'm not a fan. I like heat scan. Yeah, exactly, Elaine. I like the thermograms, and that is a heat measurement. And when your tumor forms, it requires this thing called angiogenesis, which is formation of arteries that feed the tumor. It creates heat when it does that. So these thermograms actually measure this heat, and it looks sort of like an aura kind of thing, and it'll show red where the heat is at. And they're pretty much available in every town, city, whatever. And then ultrasound or MRI. So those don't involve radiation. And why they don't do that, if they really cared about our breasts, I don't know. So anyway, there's that. Okay, so I'm going to change my screen. And how to prevent breast cancer. So know the cause, know your risk factors. So we do a lot of genetic testing. We look at things because it doesn't really matter that you have the genetics for a tumor, because there's something called epigenetics. And we know that your environment influences all of this. So even if you know you have the BRCA genes or whichever genes are associated particularly with cancer, then, we still are going to do these things to prevent it, right? We also know that there are methylation genes, the way you clear toxins in your body. So there's a lot to the story. So, if you're going to check genetics, make sure you check your methylation, your MTHFR, your COMTs, all that stuff too, because that has a huge impact. Now what we're seeing is we're seeing more of what they call triple negative breast cancers. And that means it's not estrogen receptor positive. They're not finding progesterone receptor positivity on there. And they're not seeing the HER2 receptor. So they call it triple negative. So it's like, what the heck is causing this if it's not genetics, right? And so we're seeing a lot that's just people who haven't had a family history now are popping up with breast cancer for no reason, right? Well, reason. Okay, so understand why you believe the way you do, because you're being lied to on a lot of different levels, because who has the most to gain by you understanding basic physiology, by you understanding what's happening in your body and what's influencing hormone imbalance is the number one reason. Because whether you have an estrogen receptor upregulated breast tumor or whether you just have imbalances in the estrogen progesterone system, that's a problem. Progesterone is your body's natural anti-inflammatory. It calms the cortisol response. It helps the adrenals regulate. And so if you're postmenopausal and you have none, see it every day when women come to me for the first time, you cannot regulate the estrogen, and the rest estrogen can just go crazy. And you need that balance. So it's not just estrogen dominance when you're younger. It's not just taking synthetic estrogen or progesterone. It's about the balance. And I try to tell people all the time. And it's not just one thing. Like somebody, even if you take bioidentical estrogen cream without the progesterone to balance it out, it's all about the balance. Your system not going to be regulated the way it's supposed to be. And that's another reason why I check levels, because I want to make sure that we have the ratio right. And there's something called the Omni calculator for estrogen progesterone ratios. And you can look if you're estrogen dominant, and you can be estrogen dominant if you're on the wrong therapy after menopause. So that's really important. That's another reason why checking levels is so important, because you want to make sure that it's balanced. Super important. So Nancy says, how much is the cream in your hands? We do the creams as part of our program because we want to make sure that it's balanced. We want to check your levels. We want to make sure it's right. So it's all included in the program. So once you get the test and send that in, then we can make the recommendations for your creams. And once you send the test in and you see what your levels are, there's no obligation to do our program. But the beautiful thing about our program is I bring my 25 years of experience to my team to help you get the balance correct. So that's really important. So I'm not trying to be invasive about how much the creams are. We really just want, it's a system. It's not just throwing you on some hormones. It is very precise the way we do it. Okay. So understanding why you believe the way you do, there is so much to that. And I want to just kind of throw this in here too. And I know I'm running out of time. This might have to be a part 2, but I'll kind of skip through this here. So the history of cancer. If you look back in the 1600 BCs, there were some records that women had lumpy breasts. So we kind of think from that there could be some tumors that were happening, but there was really no descriptions of like necrosis or like, like breast cancers, if you ever see them. I remember a lady one time when I first started my rural practice right out of school. This was like 25 years ago. But I remember she came in with back pain. And I was thinking you kind of wonder when you're a new doctor if people are just drug seekers. And so we could not get a handle on her back pain. And I think we did x-rays. There was nothing there. And then she said one day, can you take a little look at this little thing on my breast? And I looked, and it looked like a canker sore on her breast. And I freaked out. I'm like, how long have you had this? And she said, a year. I was like, and you never said anything? She said, yeah, I went to my primary care in Mountain Home, which was 30 minutes from where I was. And they said it was nothing. And I'm like, they said it was nothing. And she said, yeah, it wasn't quite this big then. And I was like, okay, like nothing. And it turned out that she was dead within 6 months. It had spread to her back and her spine. And so it's not a nothing, right? So anyway, we had some tumors then. And then in the 1800s, what happened? The Industrial Revolution. So there were chemicals, there were pollutants, there was stuff in our water supply, processed foods. And then we move into the 1920s to the 1950s. The cancer rates exploded. And that was the introduction of synthetic hormones. So I'll talk about that in just a minute. And then in 2001, about 70% of women were on those synthetic hormones. 2002, the study comes out, the WHI study. It freaks everybody out, justifiably so, because it was synthetic hormones. I know, sad. It was synthetic hormones. They were causing some problems, but actually the women who were getting breast cancer actually had better survival rates, even on the synthetic hormones. And it wasn't even the estrogen. it was the progestin arm, the synthetic progesterone, that was associated with the concern. So anyway, and it was all reported bad. It was the game of gossip. It was just a hot mess. But anyway, we went down to 30%. And now in 2025, 1% of women are on HRT. And yeah, we have a 1 in 8 risk of breast cancer. So if all these women were off their hormones, why would we have such an increase, 800% increase in breast cancer, and no women are HRT after menopause? So, I mean, that's one of your curiosity points. Like, just go, hey, wait a minute, that doesn't make sense. Hi, Misty. So, okay, so we had this introduction in the late 1970s, 80s of these things called endocrine disruptors. In 1928, scientists first isolated the estrone molecule. I have a lot of videos on estrone. Then they came out with DDT, which was the spray on plants. Then they came out with DES, which is a whole hot mess. I have another video on that. That was a synthetic estrogen. Then we came out with birth control pills, and then we came out with glyphosates and things that were really disrupting our cancer rates, just went through the roof. And synthetic birth control, you have a 20 to 40% increased risk of cancer risk, cause inflammation. They upregulate your estrogen and progesterone receptors. They are designed to do that, and they have been tweaked over the years to suppress your ovulation and to be more effective, 99.99% effective, because they are totally tearing up your endocrine system, your female or ovarian function, and the feedback with the brain. Estrogen dysregulation and insulin imbalance as well. So we've got all that to deal with. Okay, so I want to rush through a couple of these things here because I know we're running out of time, but some strategies that you can employ. So lifestyle, what are you eating? Maybe just clean up just a little bit, eat some salads, not all the sugary dressings on them and stuff, but a salad. When I was little and we ate so bad, it was like lettuce with that Catalina dressing, like white iceberg. That was a salad. Like, that is not a salad, right? A salad is a lot of different things. Stress, that's really important. It's easier said than done if it's emotional stress, but stress can be chemical stress. It can be alcohol. It can be, whatever it is that you're putting in your body or your emotions. Sleep is very important. Sleep goes out the window when you're menopausal because you don't have enough progesterone. Exercise is very, very important. It acts like a dose of insulin in your body. And then watching your toxins. What are you putting on your skin? What are you eating? What are you doing? Supplements. I love supplements. I take a ton. There's a few like NAD that has very powerful effects on your DNA repair. Methylfolate. Methylation is how your body clears toxins. Of course, your vitamin D, your vitamin C, your resveratrol, all the things, really important. And I will say fasting, intermittent fasting, when I put food here, is very powerful to decrease inflammation. Hormone balance, of course, self-talk, how you talk to your cells. There's an experiment that a guy named Dr. Emoto did. It was called the water experiment, where he talked to water and got different responses. And so it was, then he took that water and put it under an electron microscope. And they were saying to some of the water, they were saying nice things. And then some of the water in the experiment, these jars, he was saying not nice things. And then they froze the molecules and they looked very organized and disorganized. And so it like beautiful crystals like snowflakes. And then the other one looked terrible, like moth eaten. It was very disorganized. And so your body is like 90% water. So how you talk to your water, how you talk to yourself is really important to recognize that you are causing cellular change when you talk nice to yourself, and you're causing different cellular change when you don't, or you talk bad to yourself. Definitely spiritual, yeah. Okay, advocacy. Stand up for yourself when you go to the doctor. Like the woman I told you about, she had that lesion on her breast, and they're like, oh, it's nothing. Be your own advocate. If you know something's wrong, don't just go, oh, okay, just say next. Go to somebody that will listen to you. And especially with women and hormones, you have to have someone that will listen to you. Chemicals, endocrine disruptors, and then there's some called forever chemicals. There's PCBs and plastics. So you can look up different chemicals. I have videos just on that. So you can go watch about chemicals. Infections. We know that virus infections like HSV, like herpes viruses, things like that, actually do DNA cellular damage. And we know that that's the reason we have like the HPV vaccine, which I am terrified of that. But that's what causes cervical cancer, HPV. Anyway, that's a whole nother discussion, but that's how we have immunizations for viruses for cancer. So it's a thing, right? Okay. Parasites, won't even go there. That's a whole nother conversation. Yeast and mold and microbacteria like Lyme's disease, all those things can predispose you to cancer. Liver, your liver processes toxins, really important. And then synthetic hormones. So I'm probably going to get in trouble for this, but I'm going to do it anyway. So I'm almost done here anyway. So I do want to say, before I get kicked off for what I'm about to say, that please go order a test kit, get your hormones checked, get them balanced to decrease your risk of breast cancer, breast tumors. I mean, if you have the genetics for it, if you've been exposed to stuff your whole life, not saying you're not going to get it, but you can definitely have the advantage of decreasing your risk. And let us just look and see what your levels are. And then we can have a conversation about how to get you on bioidentical natural hormone creams. They are not medications. They are not synthetic hormones, completely different. So I want you to understand that what we're dealing with is something that is restoring your natural hormone balance with the exact hormones in your body that you're either not making or you're imbalanced making. Okay. So here I go. So this might be a good night. And if it is good night and they kick me off, I love you very much. I'm here on Monday, Wednesday, and Fridays, unless they totally kick me off the platform. And I do kind of random pop in sometimes. So you never know when I'm going to pop up and just kind of share with people. I kind of like to do that because I get a little bit of different audience sometimes. And so I love you. Yes, you're so welcome, Elaine. I just love you guys so much. So, okay, here goes. Hopefully I'll get through this. Medications that can cause cancer. It's a thing. When I was a little girl, my dad had meningitis and half of his brain was eaten up by the infection, and he had seizures. And they had him on 5 different seizure medications, and 2 of them, which was trying to think, Dilantin and phenytoin. Yeah. Which there are other seizure medications like there's a whole bunch anyway. Tegretol, that's another one. I think he was on Tegretol, not Keppra or Depakote. Those weren't around yet. But when I was 19, he got lymphoma, which was a known side effect of that, and passed away. So I'm very near and dear to knowing that medications also caused my brother to have a cleft lip and cleft palate. And people are like, they think about the moms and the birth defects, but they don't think about the sperm having the problems with the DNA. So it's a thing. This is scary. SSRIs like Prozac, Wellbutrin, Effexor. I'm not telling you to stop your medications, just telling you to do your research because it's a thing. Breast and brain cancer. How many women are on Prozac because they're misdiagnosed from menopause as being depressed? They're put on these medications that actually increase your risk of breast cancer. What the heck, right? Okay, blood pressure meds. And again, I'm not telling you to stop any medications, but the ARBs like losartan, those have been known to increase by 30% your risk of lung cancer. We also know that you can get a dry cough from things like lisinopril. So when you're looking at that, you kind of think, okay, well, it's irritating lung tissue, so that makes sense, right? Okay. Diabetes medications like Actos can increase your risk because they get filtered through the kidneys, your risk of kidney cancer, bladder cancer by 40%. People need to ask for a med insert from the pharmacy. Yeah, they do, Elaine. They do need to insert information, but it's your doctor's responsibility to give you informed consent, meaning risks, benefits, and side effects. But they don't. They just write the scripts, and it's just, it's clown world. I just hate it. Chlorine in swimming pool. Yeah, I mean, anything, right? I mean, it's like, and we're exposed to chemicals all the time. So I'm not saying that you can avoid everything, But, take your supplements, eat as healthy as you can, and exercise. And I know you, Constantina, you're all about that, and you're spiritual and you do all the things. So some of this, you just balance it out, but you pick your poisons, right? Pick your battles. Okay. PPIs, oh my gosh, they're terrifying to me. The reflux medications, the Previcids, all those. There's so much research on that. If you're on those, there are so many natural ways to treat reflux. And one of them is hormones, because when our estrogen declines, our stomach acid depletes, and then we can't digest our food, and then you start getting reflux, and it's a mess. So getting on hormones can help with reflux, and you don't need to be blocking all your stomach acid. So, there's so many class actions against so many of these companies. It's scary. And then let's see. Yeah, stomach cancer, pancreatic cancer, so connected there. And then statins, and how many women are getting put on statins, like the cholesterol blockers, and that has a very high increased risk of breast cancer as well. So it's know what causes it, know what your risk factors are. Know what your risk factors are. What are you putting in your body? And just because a doctor tells you that you need this, ask why. And am I being misdiagnosed as a hormone imbalance? Am I being misdiagnosed and I just need to get my hormones balanced? So yes, Elaine, education is key. I know my time is up, so I'm going to bounce, but I want you guys to order a hormone kit if you haven't yet. Check what your levels are, know your risk factors, know how you can get the balance, know what's going on in your body, and then we will help you find a way to get your hormones balanced and reduce your risk of any kinds of disease. And everybody's going to get sick. Everybody's going to have problems eventually. We can't prevent all of it. They're all going to go back to dust. Doesn't matter. We have an expiration date on this carbon structure. It's going to happen. But how you get there from 0 to 100 makes all the difference in knowing what's going on and who's working against you, because there are people who have a lot of financial gain, the cancer industry, the pharma industry. So there's so much. Oh, and I know they're saying, stop it. Okay, I'm going to stop it. Anyway, so know the truth, and you're so welcome. And I will be back. Let's see. Is this Wednesday? I guess it is. Yeah. So I'll be back again Friday. I love you guys so much. I'll see you then.